Are you a sociopath? A look inside the antisocial mind? Have you ever wondered if you might be a sociopath? The word sociopath gets thrown around a lot, often in a negative light, but what does it really mean? Contrary to popular belief, being a sociopath isn't about being a criminal mastermind or a heartless villain. It's a complex personality disorder characterized by a distinct pattern of thoughts, feelings, and behaviors. Sociopathy, or Antisocial Personality Disorder, ASPD, as it's clinically known, affects a small percentage of the population. People with this disorder often struggle with empathy, guilt, and remorse. They may engage in manipulative or deceitful behavior, often disregarding the rights and feelings of others. It's important to note that this article is for informational purposes only and should not be used for self-diagnosis. If you have concerns about your mental health, it's crucial to seek professional help. In the following sections, we'll delve deeper into the world of sociopathy, exploring its characteristics, potential causes, and available treatments. Understanding sociopathy, it's not just about being charming. One of the biggest misconceptions about sociopathy is that it's synonymous with being charming or charismatic. While some individuals with ASPD may possess these traits, they are not defining characteristics of the disorder. Sociopathy is a much deeper and more complex condition than simply being superficially charming. At its core, it involves a persistent pattern of disregard for social norms, rules, and the rights of others. This disregard often manifests in behaviors that are exploitative, manipulative, or even criminal. It's important to remember that not everyone who exhibits some of these traits has ASPD. Sociopathy is a clinical diagnosis that requires a comprehensive evaluation by a qualified mental health professional. In the next section, we'll explore some of the common traits associated with sociopathy to provide a better understanding of this complex disorder. Unmasking the traits. Common characteristics of sociopaths. Sociopaths often share certain traits that set them apart from the general population. These traits can manifest in various ways and to varying degrees, making it difficult to identify a sociopath based solely on outward behavior. Some common characteristics of sociopaths include lack of empathy, difficulty understanding or relating to the emotions of others. Superficial charm, appearing charming and engaging on the surface but lacking genuine emotional depth. Manipulative behavior, using others to achieve their own goals, often through deceit or coercion. Impulsivity, acting without thinking, often engaging in risky or dangerous behavior. Lack of remorse or guilt, showing little to no remorse for their actions, even when they cause harm to others. It's crucial to reiterate that these traits alone do not constitute a diagnosis of sociopathy. Many other factors contribute to this complex disorder. Do you have sociopathic tendencies? A quick quiz. While this quiz is not a substitute for a professional diagnosis, it can provide some insights into whether you might possess certain sociopathic tendencies. Answer the following questions honestly, choosing the answer that best reflects your usual thoughts and behaviors. 1. Do you find it easy to charm or manipulate others to get what you want? A. Yes, often. B. Sometimes. C. Rarely or never. 2. Do you feel remorse or guilt when you hurt someone's feelings or betray their trust? A. Rarely or never. B. Sometimes, depending on the situation. C. Yes, almost always. 3. Do you often act impulsively without considering the consequences of your actions? A. Yes, frequently. B. Occasionally. C. Rarely or never. 4. Do you find it difficult to empathize with others or understand their emotions? A. Yes, I often struggle with empathy. B. Sometimes, depending on the person and situation. C. No, I generally find it easy to empathize with others. 5. Have you ever engaged in risky or illegal behavior without considering the potential consequences? A. Yes, on multiple occasions. B. Once or twice. C. Never. Remember, this quiz is for entertainment purposes only and should not be used for self-diagnosis. Section 5. Interpreting your results. What your score really means. Now that you've completed the quiz, let's take a look at what your answers might reveal about your personality. Keep in mind that this is not a scientific assessment, and your score should not be interpreted as a definitive diagnosis. If you answered A to most of the questions, you might exhibit some sociopathic tendencies. It's important to remember that these tendencies don't necessarily mean you have ASPD. However, it might be beneficial to reflect on your behaviors and consider seeking professional guidance if you're concerned about how they're impacting your life and relationships. Answering B to most questions suggests that you might possess some traits associated with sociopathy, but they likely don't dominate your personality. It's normal to exhibit these traits to some degree, and they don't necessarily indicate a personality disorder. If you answered C to most questions, you likely don't exhibit many sociopathic tendencies. This suggests that you generally have a strong sense of empathy, remorse, and responsibility for your actions. Section 6. Seeking help and support. Resources for sociopathic individuals. If you're concerned that you or someone you know might be struggling with sociopathy, it's essential to seek professional help. A qualified mental health professional can provide an accurate diagnosis and recommend appropriate treatment options. Here are some resources that can help. The American Psychiatric Association, or APA, offers information on mental health conditions including ASPD, and can help you find a mental health professional in your area. The National Alliance on Mental Illness, known as NAMI, provides support and resources for individuals and families affected by mental illness, including ASPD. Mentalhealth.gov is a government website that offers a wealth of information on mental health, including resources for finding treatment and support. Remember, seeking help is a sign of strength, not weakness. With the right support and treatment, individuals with ASPD can learn to manage their condition and live fulfilling lives. Section 7. Living with sociopathic traits. Strategies for a fulfilling life. While sociopathy can present challenges in interpersonal relationships and daily life, individuals with this disorder can learn to manage their traits and live fulfilling lives. Here are some strategies that can help. Develop self-awareness. Recognizing and understanding your triggers and patterns of behavior is crucial for managing sociopathic tendencies. Practice empathy. While it might be challenging, consciously trying to understand and relate to the emotions of others can improve your relationships. Seek therapy. Therapy can provide a safe and supportive space to explore your thoughts and behaviors and develop coping mechanisms. Build a support system. Surrounding yourself with understanding and supportive individuals can make a significant difference in your journey. Remember, managing sociopathic traits is an ongoing process that requires patience, self-compassion, and a willingness to learn and grow. Section 8. The importance of professional diagnosis. Why self-diagnosis can be misleading. In the age of information overload, it's tempting to self-diagnose based on online quizzes, articles, or even popular portrayals of mental health conditions in movies and TV shows. However, self-diagnosis can be misleading and potentially harmful. Here's why. Many mental health conditions share similar symptoms, making it difficult to distinguish between them without professional expertise. Our perceptions of ourselves and our behaviors can be biased, leading to inaccurate self-assessments. Self-diagnosis can lead to inappropriate self-treatment or delay seeking professional help, potentially worsening the condition. If you have concerns about your mental health, it's crucial to consult with a qualified mental health professional for an accurate diagnosis and personalized treatment plan. Section 9. Debunking common myths, sociopaths, and violence. One of the most pervasive myths surrounding sociopathy is that all sociopaths are violent or dangerous. This misconception, often fueled by sensationalized media portrayals, couldn't be further from the truth. While some individuals with ASPD might engage in criminal or violent behavior, it's essential to remember that not all sociopaths are violent. Many people with ASPD live law-abiding lives and don't pose a threat to others. Aggression and violence are influenced by a multitude of factors, including environmental, social, and individual circumstances, not just personality disorders. Painting all individuals with ASPD with the same brush perpetuates stigma and prevents those who need help from seeking it. It's crucial to approach the topic of sociopathy with sensitivity, understanding, and a commitment to accurate information. Section 10. The role of empathy. Can sociopaths learn to care? One of the defining characteristics of sociopathy is a lack of empathy, the ability to understand and share the feelings of others. This lack of empathy can make it challenging for individuals with ASPD to form meaningful connections and navigate social situations effectively. However, recent research suggests that empathy might not be entirely absent in individuals with sociopathy. but rather, it might be underdeveloped or suppressed. This suggests that with the right interventions, such as therapy and social skills training, individuals with ASPD might be able to cultivate empathy and improve their interpersonal relationships. While more research is needed in this area, the possibility of developing empathy offers a glimmer of hope for individuals with sociopathy and their loved ones. Section 11. Remember, you're not alone. Finding support and understanding. If you're struggling with sociopathic traits or have been diagnosed with ASPD, it's important to remember that you're not alone. Millions of people worldwide live with this condition, and many resources are available to help you manage your traits and live a fulfilling life. Seeking professional help, connecting with support groups, and practicing self-care are crucial steps in your journey. Remember to be patient with yourself, celebrate your progress, and never give up on your pursuit of a happier and healthier life.